Good afternoon. It is Saturday, no, October 28th, 2023. And today we are going to get ready for Open Enrollment 2024 and do a little bit of window shopping. We're going to check out some plans in some select segments of Pennsylvania, mainly southeastern Pennsylvania, Lehigh Valley, New Jersey, a couple different zip codes, Maryland, and Virginia, because they have a brand new state exchange now. So we're just going to get right into it now, and hope everyone's having a good day and enjoying the 80 degrees here in southeastern Pennsylvania. Behind me, you'll notice some different graphics. This is our brand new Open Enrollment 2024 resource page that just got launched yesterday, which we're going to debut now. Okay. So our main page looks the same as always. Just, updated graphics for 2024. Some little improved functionality. Being more accessible to those with different impairments and such. So we added that in. And here's our new chat tool right here in the bottom right corner, our little friend, the robot. So when you click this, it actually is going to have you do a CAPTCHA, just because there's a lot of malicious activity out there with partners who program robots and such to kind of go after the competitors. So we had to put the CAPTCHA in. But here's the main page here. So when you see, let's get started, it's going to ask you a series of questions, because it is still we're into the Medicare annual enrollment period, which goes until December 7th, which started on October 15th. And then the under 65 enrollment periods are about to start this coming Wednesday on November 1st. So we'll just show you how to, if you do this, the Medicare one, Medicare Advantage and Part D plan. So if you're impatient, want to just go right to your options, here's our link right here. We'll take you to our plan comparer. Now, again, this is only the plans we do with this vendor here. So we're not going to see Aetna or Cigna or United Healthcare, which we do have, but we don't do them through this vendor. This is just the best tool we have that's consumer facing. The tool we use every day allows us to look at everything, even if it's plans we don't have. There's very few in Pennsylvania and Jersey that we do not have, in Delaware, Maryland too. So obviously, you can keep scrolling up and down. It's a one-page landing page type feel. A little bit more about what we're doing here. So everything kind of redirects you back. And I just kind of wanted a resource page, because sometimes people buy Medicare Advantage plans, didn't mean to, got talked into something, walked into a drugstore, supermarket, whatever. So here's just a little bit of resource. Is this your first time in an Advantage plan? Telling you how you can get out of it or no. And if it's your first year within being a Medicare beneficiary, then there's also a bit of a trial, right? So this kind of goes into that more. And how we can help you during this AEP, the information we ask. So again, you can shop yourself, but we're here to help you. So with just this basic list of information, your medication, list of your doctors, this mainly pertains to Medicare Advantage plans, supplements, as long as the doctor accepts original Medicare. In the majority of cases, if not all cases, they're going to accept whatever supplement you have. There's always weird nuances, right? So anyway, this is just a basic bit of information we require just to shop all your options in your area. Even again, if it's something we don't represent, we're still going to include it and show it to you, discuss it, because we just want the right plan for you, and your satisfaction is the utmost importance, as always. What we do with this information is kind of explaining what we do with that in our secure portal. Do I need to do anything if I'm happy with what I have? Most cases, no, but there are changes, especially with Part D plans. Plans can kind of come and go. You can get mapped into something you didn't intend. With Part D plans, you could be mapped into a plan that's 6 times the price. So, it's good to just to review your ANOC, which is your annual notice of change that the carriers are required to send to you. And if you didn't, then get in touch with your carrier and request that, because you're entitled to that, being on a Medicare Advantage or Medicare Part D standalone prescription plan. So that in a nutshell is the Medicare. And if we go back here and we look at under 65, these are the markets we represent, right? We represent Pennie in Pennsylvania, GetCoveredNJ in New Jersey, Maryland Healthcare Connection in Maryland, and brand new for this year is Virginia's new exchange. Their name is Virginia Insurance Marketplace, Virginia's Insurance Marketplace. And of course, the Healthcare.gov states, we work in a bunch of those. And if not, then we usually can point you to somebody who does. So again, do you have a plan already? Why is consent important? So I have seen ridiculous amounts of fraud this year. It's mainly from, I don't want to call out call centers, but it happens to be call centers, even though we work with a couple call centers that don't do such things and are victim of it themselves. This is being pushed everywhere, right? And consent is for your protection too. So here's our brand new consent form. Basically, all you're going to do is put your name here, and the broker that you wish to give the consent, myself, Joe Cavell, or my partner, Parsley Canals, Robin Bartow. So you can either put either one of our names here. This information is filled out for you. How I'd like to revoke consent, you can do so anytime. This is just a boilerplate form that comes from CMS, Centers for Medicare and Medicaid Services. And then, so basically all you have to do is just kind of enter your name, your phone number, your email. You can just, whatever email you prefer to use, and then just kind of scribble your name here, just put the date, hit submit, and that'll go right to me in the back end of our website. So nice and easy. So kind of just going through our little spiels here, how we help in Pennsylvania. If you have a Pennie account, we can become your broker. Same with all the state exchanges. It's very easy. You just kind of switch the broker to us. It doesn't cost you a thing whatsoever. We work with every carrier, if not just about every carrier in the markets we work in, at least every national carrier for the most part. In Pennsylvania and New Jersey, for under 65, there's really nothing we're missing. We might not have like a Freedom Life or something that's not on the marketplace, but marketplace options we do have or have access to through a partner. So what's new for the 5-county region? Lots of changes this year. We got Horizon Blue Shields coming in to compete. Jefferson Health Plans owned a company called Health Partners, which they got from Einstein when they purchased Einstein Medical, and didn't really do all that much with it, and decided to rebrand it as Jefferson Health Plans, doing Medicare, and new this year is under 65, and they look very, very competitive. My personal opinion is, if you go to Jefferson, it's definitely something to consider. If you don't go to Jefferson, there's an expanded network, but it might not be the fit for you. And again, that's only going to be this year, 2024. It's only going to be in Montgomery, Bucks, and Philadelphia counties. Highmark Blue Shield is going to be in all 5 counties of Philadelphia, actually going to be in the whole state of Pennsylvania now, as well. They've been in Delaware and West Virginia and parts of New York. So they're just kind of expanding to the only territory they didn't have in Pennsylvania. So it looks like, from the looks of it, it's all going to be PPO type products. So the price point for them doesn't really seem to be that competitive when you're comparing it to an HMO. However, if you're looking for a PPO, their network is going to be fantastic. As has been explained to me before, Blue Crosses tend to have the hospital network, whereas Blue Shields tend to have the provider doctor network. So they've kind of always had that infrastructure with that. So, I mean, and it's not a stretch to ask a doctor if they take Highmark, because really, we live in the land of unions here in Philadelphia. And I say that because a lot of unions self-insure, and maybe they're located in Delaware or central Pennsylvania, and having access to a Highmark plan where they're headquartered, that's not uncommon. So there's lots and lots of companies that like to headquarter themselves in Delaware that you might work for here in Pennsylvania if you get coverage through work or you had or you're familiar with that. So yeah, absolutely. Highmark's not a bit of a stretch where some of these new companies over the last few years, like Ambetter and Oscar and even Cigna, you think Cigna, top 5 insurance company, oh, they got to have a great network. No, I'm sorry, that's not the case at all. And their products really very, very expensive. You really got to check that network. Don't just buy things based on the name, especially in the under 65 markets and even the Medicare markets. I mean, those networks can really be a challenge. Independence Blue Cross may not always be the cheapest thing or provide the best benefits, but they have the network in terms of southeastern Pennsylvania. I really firmly believe that you almost cannot be a doctor in this area and not represent them. That being said, if you go to a Jefferson provider, you're bound to start seeing some literature, some letters sent out. I know to their Medicare recipients to call an 800 number. We work with those plans, so feel free to give us a call. You're calling some third party that's just representing Jefferson and nothing else, for the most, to my knowledge. So we want to do what's right for you and do diligently. So just be careful with some of those letters and stuff. Jefferson definitely wants to push the fact that they're doing this more now, and in an ethical way, of course. And there's going to be literature in provider offices, almost kind of like a UPMC model for those who are from the Pittsburgh area, or kind of familiar with that. Maybe live in a state where there's Ascension Health, there's a Kaiser Permanente. There's tons and tons of examples out there of providers that are also insurance companies and teaching hospitals and such. So nothing different. They're just they hired a great team of management from Ascension who has some high goals, and they really want to compete. And it's only good for the consumers here to have actual competition. I don't mean to bash any of the partners we work with. They're all great, but everyone's really struggled in the 5-county region trying to compete with Independence Blue Cross. Blue Cross has not had any formidable competition since 2016, when United Healthcare left and Aetna left and decided they no longer wanted to do Affordable Care Act plans. So this is the first time in a long time I could say they have a formidable component. I would say Ambetter has been a close second, but there's still, comparing products, they haven't had a price advantage, and they tend to go very heavy on the co-insurance, whereas the Blue Cross Proactive Series HMO plans, it's co-pays for everything, regardless of your tier. The deductible, if applicable, is only for in and outpatient hospital, not even ER. Even ER on most of those plans is a copay. So that's a plan like you really not going to see anywhere else in this country. And again, I can say I have 17 state licenses and I've helped out in many others, and I just have never seen anything that has had the dominance. I mean, they've had close to 200,000 members or exceeding that or right around there, to a combined total of under 20,000 for all of the other carriers combined. So it has been a complete dominance here for quite some time. So we're excited to actually have some competition that people can actually look at and maybe consider. I mean, obviously, like, you don't want to change a plan if it's working for you, and because it can get challenging, right? But it's good to shop, and now there's actually some things to look at and consider if you're not happy with Blue Cross. Different, nothing's one size fits all in health insurance. So yeah, that's enough of that spiel. So again, in Jersey, all these links are going to take you to our site. That's going to tell you how you can work with us step by step, how we become your broker here. And then if you look at, same with Jersey, it's going to take you to our page. So our quote tool on our website that we've had for years through Quote It, fantastic tool. But with these state exchanges like Pennie, GetCoveredNJ, Maryland and Virginia now, nothing supports those at the moment. So Health Sherpas, all these third parties, you have to shop and enroll for the most part through the exchange. You at least have to enroll through the exchange as of right now. There's no carrier can do it any easier. The exchange is the enrollment, which is great, I think, in many aspects, because again, most of the fraud I've seen throughout the last couple of years here has really been in the Healthcare.gov states, when really all they need is your birth date to just kind of wreak all kinds of havoc. So those consent forms are for both of our protections. So we're on the same page to know that, hey, you want to work with us, and we're going to represent you in the capacity that you envision that we're going to do. So this will take you to our Health Sherpa page to quote. You can look at plans, but you won't be able to enroll in anything. Is this showing us? This might just be showing us 23. Let's see if it's kind of switched over. This is actually with the Medicaid expansions. All this is about the lowest qualifying income. Yeah, so it's showing 2024 plans. So we'll just get into it now while we're in Pennsylvania, 5 counties. So if you're just looking, right, you're going to see Jefferson, you're going to see Ambetter with a price advantage to Blue Cross. I mean, Blue Cross is right here. So there are some 0 price points in this lowest income. Anything really under that's going to get you sent to Medicaid. So it's about 200 or so. You can see it's the same savings as it was there. So that's about the benchmark in which you have to qualify or estimate your income for 2024. So again, remember, this is always a projected income. And actually, last night, because this is the time of year we work all the time, we've really been working on this blog. There's a whole article with the assistance of some of our writing softwares here. I do like to write. I do some blog posts, but I have fully embraced some of the artificial intelligence out there. So this is powered by Jasper, which is, you have to give it a framework and tell it what it wants. But what it writes is absolutely brilliant. And it's actually in your tone. I mean, I've had it scan this page for the blog entries we put for years and years and years. And it's amazing what it can do. So anyway, this just kind of talks about modified adjusted gross. It's in our blog. We had a piece that we did back on the 18th about the donut hole and how it's changing. And then most of our blog posts in the past have really just kind of been the e-blasts we get. And if you want to sign up for our newsletter, it is on the bottom of our page here. We also have a way you can just get to us real quick if you want. You don't want to play with tools or anything. But if you put your email, you'll subscribe to our newsletter. And we don't send out a lot. We really only send that out during this time of year when pivotal points, like the first day, as we get closer to the 15th, around the holidays, is like a thank you type message for working with us. And right toward the end there on January 15th for most of the country, the 31st for a couple states. Again, Medicare ends on December 7th for the annual enrollment period. So going back to, just to wrap that up again before we get into some window shopping. So again, as I said, the link to when you select your state, the link here is going to take you to our Health Sherpa. And it's big red link there. If you have a plan already, why consent's important, which we went over. Can you send me a quote? Of course we can. We can send you a quote. We're just basic information we need for what's modified adjusted gross income. Again, there's a little tidbit, but there's more. And then if you just want to message us there's our contact info. And the coolest thing here is our new tool here. So it's programmed to only answer questions about insurance. So this is powered by ChatGPT. Can't fight progress, right? So anyway, basic things I've asked it in the past. Let's just say, let's say you're filling out an application. So what I recommend you do, they have chat tools here, but there's a lot of nuances when you're quoting, right? If you put like a 0 income, it's going to tell you get no savings. If you put like 1,100 income, it's going to tell you go to Medicaid. So again, you really need to be over that amount here to see what the prices are. And it's a projection of your income again, right? So think of it like this. The federal government says to you, right, guess your income in this case for 2024. And at the end of the year, we're going to settle up. if you make more money than you said, you're going to owe me, the federal government, back. I'm not, this is the federal government talking. If you make less, then you're going to get a tax credit back, or you're going to get what's owed back to you, right? So think of it like that. So you're not doing anything fraudulent. As long as you're filing taxes. If you're not filing taxes, if you're on disability, your income is just really low, you have to file taxes, because you're at the end, you're kind of agreeing to that at the end of all the application process. You're agreeing that you're going to let them check your IRS records, because that's just kind of how it works. They're not going to give you the tax credit without kind of playing in their playground, in a sense, right? So there's way, you have to qualify them, in a sense. You can't have coverage through work, or at least you have to prove it's unaffordable, which is very hard. So if you pay like $1,500 for your family, that might not just be unaffordable, right? What they look at is it affordable to you, the employee? Now, the Family Glitch Act was removed. A family glitch was removed in the fact that now those dependents before were blocked out from a subsidy. Now they can go, but the employee himself, if he's offered the portion he pays. So if I'm the employee and I pay $30 a month, but I have to pay for my family in full, that's still affordable in terms of ACA compliance, right? So that's really good to be aware of there. So we all think things are unaffordable, but it's got to be it's got to be the portion that you pay every month can't exceed 9.8% income. So if you pay $30 a month, say 30 times 12 is well, and you take you take your salary and you times it by 0.098. That number, what you pay for health insurance for yourself as an employee, cannot exceed that number. If so, it's unaffordable. You have to answer the questions truthfully. So as you go through there, it's going to say, do you get coverage to work? If you answer yes, you have to answer truthfully, because they will send a letter to your employer, and if they can prove that you had access to health insurance, you will lose or owe back that subsidy. So they will find out, right? So you can't just kind of fraud them in that sense. But you have to answer that question. If you answer that question, I don't know, in most cases, it's going to not have a tax credit. So it's a yes or no answer, right? I'm offered health insurance, I'm not offered health insurance. And then you can get into the weeds about, if and when something's unaffordable, 9.8%. So let's not bore you too much with all that. Let's just get right into the shopping here. So in this income range, so as we've explained many times, there's cost sharing reductions, right? CSR. This is available based on your income. If I put a $40,000 income, I don't have any CSR. So what that means is not only does the plan get better in terms of price, the benefits get better. So if I put the lowest income available and I'm in that threshold, silver is the way to go, because cost sharing reductions is only applicable to silver plans, which we've covered many times, right? Unless it's the first time you're tuning in. Understandable, is kind of confusing. So this is only applied to silver level plans. So in certain parts of the country, the majority of the country, you'll find that silver plans are more expensive than gold plans, because the insurance companies have to pay this cost sharing reduction. When the law was first written, the Affordable Care Act, or Obamacare, whatever you want to call it, when that law was first written, the reimbursement was coming from the government. And then throughout the years, as time went on, it switched to being paid by the insurance company. So the insurance company is going to obviously in turn, make the silver plans more expensive than the gold. This was not the case with Independence Blue Cross, because we have always had the zero proactive plan, or low deductible proactive plan, right? So if we just get right into that. So that's going to be, why is it showing us this? Oh, we have to put Keystone. That's why. So Keystone, right? So this plan right here. So all these are zeroed out based on that income. With a higher income, and you can play with this. With a higher income, you'd be surprised how high you can go too. I mean, really, like, it's, bet I could get it. So normally, for years and years, anything over like $50,000 got no credit. With the Inflation Reduction Act, or no, that wasn't the one. I've lost track of all the different bills. The one that was passed during COVID in like 2021 expanded the eligibility. So it took away that hard cap that it used to have, and long story short, people are qualifying that normally didn't before. I mean, I think I ran the numbers. I found a family of 4 in Delaware with adult children, because under 26, you can still claim them on the health insurance and dependents. Yeah, at $300,000, they were still getting a tax credit. So, I mean, don't just chalk up and say, "Oh, I make too much money." I mean, really play with these tools, because here you see, I'm still saving $100 at $80,000 for a single. If I had family members, it's even more. So, say I had family members, they didn't want to enroll. Look how much more money I just got just for having three family members, and I bet my threshold's higher now too. It is. So I can go to 100,000. So family makeup means a lot too, right? Also defining household. People get confused by that, right? When you're defining your household, look at your tax return. Who you claim as dependent, how you file. Are you married, filing single, filing separately? Are you married but living in separate households? All those different things. It's complicated, right? And these apps aren't always the best at teaching that. There are people here that help. And again, when you're in our portal, we do retain you as the broker, but they do help. But what I also recommend is, keep our assistant open here, and you can ask it questions like, ask something like, is student loan interest counted towards modified adjusted gross income? So here we go. Yes, student loan interest not counted towards yes, student loan interest is generally not counted towards MAGI for most tax purposes. However, please keep in mind that I can provide general information. It is always a good idea to consult with a tax professional or financial advisor for specific advice regarding your situation. Is there anything I can help you with? Sure. Is my payment the deduction, or is the interest? Right? People just tend to just put the amount they pay every month. That is not your deduction. Your deduction is the interest. When it comes to student loan interest, it is typically the interest portion of the payment that is eligible for deduction rather than the entire payment itself. So it would be great if we could all deduct what we pay every month, right? That's not the IRS code there in a sense. Could also be something like, maybe you don't know, is alimony considered income for MAGI? Yes, alimony is considered income for modified adjust. If you receive alimony payments, they're generally included as part of your MAGI calculation. However, it's important to note that laws and regulations may change. So yeah, in that article. So again, do not take this as the end all be all. The ChatGPT and Bard and these tools, they're fantastic, right? But they're not perfect. So this is not meant to replace us in any way. We are still here to help you every step of the time. But we have a lot of customers that really just kind of do things themselves, get intimidated by talking to somebody. Maybe you filled out a form online. I mean, we do advertising too, right? You fill out a form, you get 600 phone calls. That's not how we work. We're only going to contact you if you ask, like you fill out something on our form, you request it. If you say don't, we're done. Like, we're not working with anybody else but ourselves here. So I know you get a lot of calls because you fill stuff out, but that's right. This is meant to just kind of be a resource if you're shopping at 3 o'clock in the morning or something. And obviously, we're not there to pick up the phone because there's only 2 of us, right? So this is just kind of meant to kind of guide you with some of your questions. Maybe like, if you're doing Medicare, what is the donut hole? So it kind of explains the donut hole a little bit more too. So this is a great tool available to you. Yeah, you just click our little buddy there in the corner. And again, when you're on the home page, when you click our little buddy, he's just taking you to this resource page. And that's that in a nutshell. Let's get back to shopping. Sorry to divert. So let's use an income that's going to get us the most benefit in this plan. So you're self-employed contractor, you're like, I make about 18, 19,000, right? Project 20,200 to kind of get onto the program here. Or I'll go to Medicaid. I mean, go to Medicaid, get denied, then you can qualify. Same with kids, right? Everybody always wants to add their kids. Kids can really only be added depending on the income. So let's just say I'll show you. So let's put a wife in here or a spouse. Do that. Let's do 52. Add a dependent 13. Add a dependent 14. So this tool is fantastic. And also Pennie has a tool too. You can go right to, you go to enroll.pennie.com. right? Just shop for plans and put all that stuff in. But I feel like this just kind of makes it easier. That gets a little convoluted. So here, that's too little of an income. So if I put 50,000, right, 50,000, it wants to send the kids to CHIP here, right? So there is a spot in which the kids. So if the kids get denied CHIP, and CHIP in most cases is the place to go, that's great coverage, and you can shop that. If they put you with United Healthcare and the kid's doctor doesn't take it, call up Blue Cross, call up Highmark, whoever you want to go with, and say, "Hey, I'd like to transfer CHIP to you." They're just not being favorites. So it's ran by the state, and they just kind of select on a round robin case. Like, okay, Aetna gets you now, United gets you now, PA Health and Wellness, whoever it might be, right? There's no favoritism being played there, but you can request to be changed. So let's say now if I put 100,000, I don't know where the mark is for this. So that's a little too much. I'll just say 80. So 80,000 still is sending the kids to CHIP. 90,000 is still sending the kids to CHIP. So about 100,000, you can see how our tax credit, now the kids can go on the plan. So everybody always asks about this. It's two different programs fighting each other. It's the federal program, because even though it's running a state exchange, like here in Pennie in Pennsylvania, it's still a federal funded program, right, through tax credits through the IRS. So you have a federal program arguing with a state program as to who the kids or whoever, Medicaid, whatever it might be covered with, right? So, try that first. If you get denied, then they can be added regardless of income. There's a box you click that says, I've been denied Medicaid. They do now, they check this, right? Because for a long time, I'm sure people just would check that box anyway. Now with the states running things, the one thing that's an advantage now with the state running thing is the state can seamlessly transfer, hopefully can transfer from one entity to the next. So you didn't qualify for Medicaid, they send it to Pennie, whatever it might be. You start in Pennie, you make too low of an income, they send you to Medicaid or CHIP, right? It's supposed to be more of a seamless process. If it is or not, it's debatable, but it's definitely a smoother process than it has been with Healthcare.gov in that sense, right? Because I've worked with a rep at United Healthcare for many years that taught me a lot about CHIP, and especially early on, those apps would just sit there and sit there and sit there. So I would tell people, like, don't just fill something out on the exchange. Like, if you think your kids are going to qualify CHIP, or you want them to qualify for CHIP, right? Be proactive, reach out to PA Compass or CHIP or whatever it might be, depending on the income level. Again, we'll guide you. We do this all the time. We do not charge fees. At least once a month, we have a talk with somebody, guiding them to Medicare, right? This is what we like to do. People come back or refer people, situations change, right? That's just the nature of the beast. We've been doing this since 2013 or so. All right, so again, enough rambling. So let's just keep things simple. Let's make it a household of one. Let's take everybody out except for the applicant. Let's make it here just because it's easier to just kind of get a sense of everything. So we're getting the max benefit. So again, as I showed the benefit, so for the last couple years, I know Blue Cross has brought different plans. This has been the benchmark for this income. And again, if you compare it to a gold plan, look at your out-of-pocket max here versus your gold plan at this income level, right? Your goal, look, I mean, we're at $8,000 on all of them. We don't have to show the exact plan, but so on the silver plan, this is why at this income or so, like, you really got to check the benefits. And this tool makes it really easy. Pennie's great too, but this tool really makes it easy. So again, you can't buy anything. If you go to buy something, it's just going to tell you to call me or send you a link. Yeah, it's just going to tell you to call me at some point. This is just getting used, but usually it just gives you an 800 number to call me. Like if I did 2023 and I tried to buy a plan. Yeah, see, so they can't handle state exchanges. So I think they're just getting geared up for next year, 2024. So yeah, let's just compare some of the options. So here's the first Jefferson plan, the price leader in silver, and I believe bronze too. And Better's right there fighting them, but right there with them. So it's definitely going to get some eyeballs on it. I look at gold plan. So, I mean, Highmark, it's almost next to impossible to get the prices of a PPO there with an HMO. So 271, because I get a lot of questions about this. People want to upgrade their coverage, and then they see, they price you out of PPO, so you're really paying for that. So you can see they have a bit of a stranglehold on Blue Cross in terms of this EPO, especially in the gold category here. This is cheaper than Blue Cross's benchmark gold proactive plan by quite a bit. And I haven't even looked at a PPO. If I look at a PPO, $395. So yeah, they definitely have a market, especially if you're looking for good coverage. Highmark definitely is going to be a formidable opponent here. And there's also some other chaos, right? Anybody with a company plan or an individual plan not affecting Medicare yet, and you've had a dental plan, you currently have United Concordia as your dental network, it's going to be switching to Dominion Dental. So United Concordia is owned by Highmark, and there's some little disputes there between the two blues. So needless to say, Dominion Dental is going to be the network, which Blue Cross IBX assures that it's going to be almost a complete overlap. But just want to make you aware of that and check that out. And we do dental plans too, of course. You can just toggle dental there if you just want to see some exchange dental, but sky's the limit with dental. In fact, if you go back to our resource page, dental insurance. So here's our dental link to shop a bunch of different ones on our tool here. And then here's some more expanded options we got through Morgan White. Okay. So let's just look at some silver benchmarks. So these they always bring this down to the wire. Medicare, we look at the plans in June, July, August. When it comes to under 65, we're learning about this days before, usually the day of. So Health Sharp is great because they really did the window shopping for everybody right away, right off the bat here. So we're just going to look at some. Now there's a new plan that they have. We're just going to look at that. What I like about the Jefferson plans, they're the only one I've seen that's a $0 bronze plan that has co-pays for everything. There is no co-insurance. So they really listen to us brokers and clients. And, we said what's important, and they've listened. That's what you want out of a partner. That's fantastic. So their new plan is called the Franklin Silver. So if we just compare these two, Clear, Complete, Jefferson, where is the Franklin? Here's the Franklin Silver that they feel is going to compete with Blue Cross. Now, if you're just price centric, you have to look at a lot of these benefits. So this might be zero with a $500 deductible and a $550 out-of-pocket max. This is zero with a $13 out-of-pocket max. This is the number here. So this just says after I pay $500 for the year, I'm pretty much done. I mean, there's nuances, and sometimes you maybe have to argue with the carrier that you've hit the out-of-pocket max, but I mean, that's pretty much done there. So if we just kind of compare those, so we're in the silver categories, proactive basic. Yeah. So at that income, I mean, the proactive plan we picked, the essential really is the leader. At a full with no cost sharing, it's like a 5,000 deductible, usually for the tier 1. It's tiered again, right? Where you go matters. Everybody takes it in the area for the most part. I mean, it's hard pressed to find someone who doesn't, but certain hospital chains have the lower deductibles and certain ones have the higher deductibles. And not everybody explains this well on these plans and stuff. So your hospitals like Abington and Doylestown, Grandview, St. Luke's, they're all going to be your tier 1. Chestnut Hill, Crozier, tier 1s, right? Your higher tiers are going to be your teaching hospitals. Jefferson in the city is a different contract. It's a higher tier. Temple, Penn Medicine. So, you got to be aware with that. And again, Jefferson's doing it too. And those, Ambetter's got a network too. It all depends, right? Ambetter's a newer company, has partnered with Jefferson. A lot of doctors are really owned by a health system now. They don't know what they have. So sometimes there's some education needed, like, hey, this is in the network. So there's some nuances with that you don't usually have with a Blue Cross. Here's Oscar still kind of hanging around. They do take Temple, but they have network issues. Here's their cheapest silver. I mean, this is just not really looking at. Here's Cigna. Cigna's a great company, but they really just priced themselves out again. They won't even let us add it. We haven't even gotten to a Highmark plan because they're PPOs and they're really not trying to tackle this silver market. I mean, the plans are good, but I mean, you could definitely make a case for that too. So let's just compare some plans here. So there's your deductible, there's your out-of-pocket maxes. Again, your benchmark has been this plan at this income, $5 versus no, $5 no charge, 15 versus free, 15 versus no, this isn't even after deductible. There is no deductible. This is after deductible. So this is a formidable plan. This out-of-pocket max, you're pretty much guaranteed to pay this. Here, you may never hit that. $50. This is a little high for cost sharing reductions at that income. I mean, it really should be in this neighborhood. This is the one downfall. I do feel this being a little high. Urgent care facilities, no charge. Got to be a network, or it's got to accept the plan, right? First 5 days, 50 per day, zero, pretty much identical to that. And then that Franklin Silver here, 2005-15, no charge, 15. So there tends to be some co-insurance that, so for full plan details, is there co-insurance? Yeah, so a little bit there. Oh, that's pretty good there. It does definitely mimic more of that. No charge, after deductible. Well, there's no at this income, there's no deductible unless it's $40. Yeah, so in this category, I mean, I really see it being there. Let's change it now. Let's go to an $80,000 income. We're still getting a tax credit. Let's compare our plans. Now our deductibles have matched. So here's where they've always kind of had the stranglehold over these other ones, in that this is only for in and outpatient. It's a little higher for those higher tiers. It's closer to like 8,000. The out of pockets are all kind of in line. This is pretty good. I mean, in terms of like having a lower, again, this is that same thing. You satisfy, you're done. Primary cares are kind of comparable. Laboratory professional 250, emergency rooms. So yeah, I mean, the Franklin is definitely formidable in terms of a price point, but it really doesn't have an advantage if I'm looking at what the total cost is. But this is a formidable opponent here. Okay, and then if we do gold plans, so let's say we want to look at gold plans. So maybe we look at the clear. I think the Focus is the most popular. I think we're kind of confused by them. 900 deductible. I mean, they're really Gold Classic HMO. It's undercutting that. 1,500 out of pocket max. So gold's the best you could possibly get in anything. And Highmark, I mean, here's the gold preferred, Blue Cross's best plan. Let's just do creme de la creme plans just to kind of give you a sense. Let's compare the blues, because I think this is going to be confusing for a lot of people. So let's go after the best plan here. That actually has adult dental and vision in it. Let's just kind of keep things simple. Pair of plans here, the deductibles, the out-of-pocket maxes, Highmark being in the center of the two blues, definitely has a lower. Blue Crosses, very, very similar. Emergency room band, very, very similar. Got a cost advantage on it there, so definitely something to consider. It's not going to be as easy as years past. We're definitely going to be doing some shopping this year, that's for sure. Okay, then, all right, let's change and just look at Lehigh Valley real quick. So their gold plans have been cheaper than silvers. Highmark's really kind of had a stranglehold there. Capital's good too. So it's all about networks up there more than ever. Typically, Capital's EPOs have worked best at St. Luke's. Oscar has worked best at St. Luke's. That's their network. Ambetter is PA Health and Wellness. That has worked best at Lehigh. Highmark has different types of networks up there. The Direct Valley is the limited one that works at Lehigh. The ones without Valley in the title or direct like this has more freedom in network. Capital PPO is taken everywhere. Geisinger kind of falls in the middle. I mean, they have their own facilities, obviously. Now they got purchased by Kaiser, or partnered with Kaiser or something of that nature. Yeah, I mean, they kind of work at both health systems too. It depends. So you got to check networks. You got to check networks with everything. So that covers PA in a nutshell. Let's go right to Jersey because you got United Healthcare now. So we're just looking at this 56-year-old again. Let's just go to the fully. And Aetna really kind of came in there swinging last year in 2023, or well, this year, or it was a year ahead. So, so yeah, the Aetna has been a formidable opponent over there. So let's get rid of this. And we're going to look at the Aetna Silver 2. Has been a pretty good plan. Aetna, Mera Life, Mera Health, great plan. There's UHC coming in hot and heavy back using that old Oxford, not Oscar, Oxford network. People who live in New Jersey, especially the northern parts, probably more familiar with that. And then, yeah, there's Horizon there just kind of hanging out. Wow, it's not a whole lot of plan options, huh? So if we want to go right to silver, I mean, they're still hanging in there. The mainstay of Horizon, Blue Cross Blue Shield. Maybe I'm doing the Hospital Advantage. Networks are an issue in Jersey. None really let you leave the state of Jersey. They really are like state specific. Aetna and United are no different. Ambetter is really your only choice. You can go to anybody in the country that takes Ambetter, or here would be WellCare. So Ambetter by WellCare. So this gives you total freedom. So if you're Snowbird, you live in Florida, you want to see PA doctors, you're limited to this network, but at least you can leave the state. Everything else, you really got to stay. Horizon Gold, Omnia is the only thing that really lets you go to other Blue Cross doctors outside of the area. And it's probably, even at this income, is astronomical, right? $1,700. I mean, they make you pay for that freedom. So if we're just looking at silver, so United's new here. Just kind of doing a quick comparison. I'm not a fan of these co-insurance, and you just don't get much. You're looking for those co-pays. Well, it depends what's important to you, right? So here's some comparisons in Jersey. This is like Camden area. You want to change and check out Jersey City. Jersey City here. So our carrier, there's our carrier. We got Oscar up there. A little bit different plan offerings. That looks really good up there. Oscar has been, they're one of their main markets because they're a New York City based company. One of their main markets has really been Jersey for years. So they have the best, I think their best network is in Jersey because they don't try to build their own. At least they haven't in the past. They go off of, a rented network, QualCare or something like that. I forget what it is. Correct me if I'm wrong. So there's Jersey. So United Healthcare being the new kid on the block in Jersey again. They're back again. I actually learned something at our kickoff was that, and again, I work for Do It For Me Insurance is my brand, but I'm also a product specialist, broker manager, product development, business development for custom benefit plans, hence the shirt. So when we did our kickoff, I actually learned from and why that benefits you is I have not only do I train others, tell them what to sell and to look at on a daily basis, I also coordinate with insurance carrier reps all the time, and I can really kind of get answers very quickly because of being part of the mothership in a sense, right? So what I learned from United that at our kickoff meeting for our brokers was that if you leave a state, believe it's a Affordable Care Act rule that you can't come back for X amount of years. So I think they wanted to come back, but really couldn't. So now United's coming back. So that wraps up Jersey. Let's now look at Maryland. So what's changed in Maryland? So Maryland is Maryland Healthcare Connection. We work with everybody there. United, Aetna's new this year to that area. I'm not seeing them there though, so I have to do a deep dive. But here's just some of the options, and I don't want to bore since most of my audience is going to be in Pennsylvania and Jersey. If you're in Maryland, reach out. I'd love to help you. And I want to take a quick look at Virginia. So this is Aetna. Aetna's down there. So this is Fairfax, Virginia. Have a lot to choose from. I personally work with these in Virginia. This is Anthem, Blue Cross Blue Shield, Kaiser. So these are the ones I work. I don't know what these other are, but my system, we can still work with and help you there. So that's some of the options in the brand new marketplace for Virginia, which have our new page built, fee-free health insurance marketplace. This is the same exact, you can see, this is the same thing. It's Get Insured, built this for Virginia too. Maryland's a little different. Maryland has their own because they've done it from the get-go, whereas everybody else just kind of got into it in the last couple of years or so. Maryland's never been, to my knowledge, at least that I can recall, has been a Healthcare.gov state. They had their own exchange and they really have a handle. So that's how you add us for that. And you can run all kinds of quotes here, individual, temporary, if you're just between jobs, market specific, right? And there's some nuances coming with short-term medical, talking about an executive order being passed where they're going to limit it to 3 months and you can only renew it for an extra month. So you can't stack 3-month policies at once like we did the last time that an administration did that. So we're just waiting on news on that. It's going to affect indemnity plans too, like Aflac and stuff, which are plans like I have myself, a United plan that helps kind of fill in the holes of the plan and kind of pays you when you get sick or, even when you get like physicals and stuff done. So, there's definitely every category, every instance, every situation is different. And that's why you work with us, because we help you look at the big picture. Anybody can go quote tools and buy things, but how do you know what you're buying unless someone explained it to you, right? And I understand there's a lot of, disgusting activity out there, but if you ask any of my clients, the reason why we get so many referrals and brokers want to work with us, because we're small. I work for Custom Benefits, a small family business. Do It For Me Insurance is just me and my partner Robin, right? So they work with us because we give them that concierge service, right? It gets crazy this time of year. Sometimes we're not always best at answering our phones. We do get back to you. Please leave a message if we're not familiar with your number, because we just get a lot of nonsense calls too. But we want to get to those that want to help. Nonsense meaning solicitor spam, people wanting us to work with them, sell us health insurance, junk like that. Right? Actually have fun with them people on the phone. But anyway, so yeah, we're here to help. And our resource page is available to you. And actually, for fun, just want to see, because I have a good amount of clients down in San Angelo, Texas. Just want to kind of see a Blue Cross. So, I'm learning too these days, and usually I'm doing it on November 1st. So I'm glad to get a little bit of a jump here. It's actually Tom Green County. Oh, it's actually United down there. Somebody making some calls to some of my Texas clients. Who knows what the network looks like? So here in a healthcare.gov site, you can just buy, start the application. Texas can be a challenge. We don't realize how spoiled we are here up in the Philadelphia region, right? We have a plan that doesn't have a lot of deductibles or anything like that, and a lot of copays to it, right? It can be real manageable. Everybody takes our plans. I have clients in Texas or clients who've moved to Texas, but they'll go to providers and being told that no marketplace plans accepted at all. So yeah, everybody's opinionated on the Affordable Care Act, things of that nature, but really actually as good as it gets in this market in terms of access to providers and stuff and that access. You go to certain areas of the country and you don't even have a PPO to buy, period. You don't have a plan to let you leave the state. You're stuck there, right? And again, you want to know what these things are? Hey, we got our friend there, right? So we could just say, what's the difference between an PPO and a PPO? Let's just ask it. What's it think it is, right? So there you go. There's a whole, basically an EPO is a PPO without out-of-network benefits. So you have to stay to a network, but in most cases you don't need a referral. It's not an HMO, but it's still confining you to a network. So there our friend can kind of give you some inputs on that too. So that is going to conclude our presentation, window shopping, unveiling of our new open enrollment resource page. Thanks for tuning in. Again, we're here, 267-374-0975 is my personal cell. You can call, text, email, Joseph L. Covell, Gmail, jcovell@doitformeinsurance.com. Goes to my Gmail too, but it looks a little better. And that's kind of it for that. So if you have any questions, we're here, and open enrollment starts November 1st is when we can start switching, and we can look at plans now through Health Sherpa, but we can't buy a new plan or change a plan or update anything until Wednesday, November 1st. And that will go until December 15th in Pennsylvania, 31st in New Jersey and some other states, Healthcare.gov, the 15th of December. That's for you to get coverage for January 1st, but the actual enrollment itself goes until January 15th. I think there's a holiday, so I think we get a couple more days in Pennsylvania. I think it's the 18th or the 19th. I'm not sure, but target the 15th. And then it's the 31st again of January for Jersey and some other state exchanges. So thanks so much for tuning in, and we appreciate your business and your referrals, and let us know how we can help you this open enrollment season.